Dr. Molly with Your Goals Physical Therapy. This video, I wanted to talk about front hip pain when you're kicking. So a lot of these wonderfully fun gyms are popping up where they do kickboxing. It's like a circuit and they're a lot of fun and they're high intensity and they're absolutely, they're super fun. They help you make friends because everybody works out at the same time. So you meet everybody that's in your class. Absolutely fabulous. But sometimes what happens is you get into those classes, it gets really intense, and for some reason the front of your hip starts to hurt and it slows down your workouts. That hip pain in the front is very common, a hip flexor strain. And what that means is the muscle that runs from the front of your hip bone down to your knee, it ends up getting a little bit overworked, or not a little bit, sometimes it's a lot, because there can be a lot of kicking in those classes. And if you're not icing at the end of your sessions, and if you're not stretching enough, and sometimes it's just the amount of work that's happening, you can easily strain the front of one of your hips. And typically we're so you'll have one hip that's bothering you and the other one that's not. And it's not necessarily because there's something weird about your body. It's just that we tend to kick more with one side or harder with one side than we do the other. But this video, like where I sparked this from, was my client, Frank. So Frank contacted me roughly 3 or 4 months ago because he was having hip pain in the front of his hip and he didn't really understand why. So as we're talking, he's telling me that, because I was like, well, I love kickboxing, but how did you get into kickboxing? So he's telling me the story that he went for his annual physical with his doctor, and the doctor basically told him that he needed to, it was a little abrupt, right? This was a very harsh conversation, but they told him that he needed to lose weight and they needed to watch what he ate because his cholesterol, his blood pressure, his sugar levels were all elevated and his weight was becoming a problem for him. And if he didn't fix it, they told him basically he was just waiting to have a stroke or a heart attack. So he needed to do something now. And they were being rather aggressive, and he took that very much to heart because he has a wife and he has kids, and his head started spinning about what would happen if one of those things happened to him. And so he made this big resolution that he's going to lose all this weight and he's going to get super healthy. And just like he is in business and his work, he went all in. So he joined a gym. He was going 5 days a week, and he lost a lot of weight very quickly, and he was doing wonderful until the front of his hip started hurting. And then it was like everything came to a screeching halt, because it went from being mildly achy at the end of a session to being almost where now he couldn't even walk. Even if he got up and down from a chair, it was very, very hurtful and painful. He wasn't finding any relief when he iced. He couldn't get any relief when he was stretching. And so he was really afraid that he was going to need to have some form of hip surgery now on top of this. All he was trying to do was get healthy, and now he thinks he's going to need to have hip surgery. And when he went to the doctor, he was mildly happy because the doctor told him, well, it's not arthritis, it's not anything. I'm going to give you some anti-inflammatories, and I want you to go home and rest. Well, to Frank, that was horrible, because if he rests at home, he's going to gain all the weight back. And then all these other things, all these other health complications are going to come back that he had done a good job of eliminating or reducing, at least in many cases. His heart rate was already lower, his blood pressure was better, and so he just looked at this like he was completely deflated. When he called me, he was just completely upset. He thought that he should have been able to know that this was going to be a problem. He thought that, like he was going to know spontaneously that he was going to injure himself, and somehow the injury is his fault. And so he was just battling with quite a few things, because he was also worried what would happen if he wasn't able to work out, and would he gain all the weight back, and would his health decline. And so it was very quickly when we discovered that it wasn't just that he was having fun doing the kickboxing, and the classes were all exciting and the people were wonderful. It was really what kickboxing meant to him and what it meant to him in regards to his family. This was his way of helping his family stay safe, that he was going to be around for a little bit longer and be able to do things with them and not be a burden. And so he came to me, he was, really worried that he was going to have some form of hip surgery or do something dramatic with that. And so he was describing all the things that he was doing. And like I said, he was icing it every day, which somewhat got rid of it, but like at least calmed it down, but it didn't really do much. And the same thing with stretching. He was like, I've been stretching and stretching and stretching, and it's just not going away. He's like, I've taken a couple weeks off and it doesn't hurt now every time I walk, but if I go to do any kind of kicking motion, it's over. And it's like, so do I have to just give up kickboxing? Is this like, what, tell me what I have to do. So when he came in and he did the evaluation, we were able to pinpoint exactly why that one hip was the problem and not both. We were able to create a program that specifically helped him get back to kickboxing. And after a few weeks, he stopped having pain when he was getting up and down from a chair and moving around just in his everyday life. He stopped having pain altogether. And then we worked on making him stronger, and he felt a lot more stable after that, even on one foot and doing some dynamic motions. And then we got him back to 100%, where he was able to make it through a full class with no pain at all. He knows exactly what he's supposed to do to keep all of that, and how to cross train and do what he needs to make sure that he stays, his muscles work well enough to make it through all those classes just like he wants to work out. So he went from being completely worried that he was going to possibly have to have some form of hip surgery or something. He sprained his hip, it's going to be long and dramatic. And now he is back to working out his 5 days a week. He is back on his diet plan, and he is on his way to making all the progress that he wants to improve his health. So if that is the type of care that you're looking for, feel free to ask to talk to a therapist. I'll leave that form down there, and so we can talk just to make sure that this is something that would work for you, for your specific situation. And if you want, I also have some free ebooks. I can put a couple of those down just so you can see what kind of tips and tricks that I have for you. But I hope you're having a good day.